Psychological factors contribute to delayed recovery of employee physical injury and trauma, causing enormous financial strain on both themselves and their employers. As a national behavioral health provider, Ascellus is focused on helping injured workers get back to work sooner by restoring their emotional and physical well-being. And we do it through work-focused cognitive behavioral therapy, also known as WCBT. So what is WCBT? WCBT emphasizes teaching to build cognitive and behavioral therapy skills to address psychological symptoms, limitations, and impairments that impact functioning in the work setting. Our national network of over 1,500 psychologists, psychiatrists, and licensed clinical social workers leverage WCBT to assess and treat the psychosocial issues that escalate pain and prevent recovery. Additionally, WCBT helps patients understand their injury, set goals for their recovery, and get the tools and skills they need to be returned to work ready. WCBT relies on collaboration between treatment providers and injured workers in a way that's structured with brief intervention. Through WCBT, injured workers at risk for delayed recovery learn cognitive and behavioral strategies that drive meaningful and measurable results. On average, 87% of individuals that we treat are returned to work ready in just 7 weeks. We deliver our full suite of WCBT programs through Ascellus Connect, a HIPAA-compliant, all-in-one technology solution that enables a more efficient and convenient treatment experience. Through integrated avenues of telehealth or in-person cognitive behavioral therapy, we're able to deliver customized treatment programs, reduce costs for workers' compensation claims, and empower injured workers to get better and stay better so that they and their employers can get back to business. This is behavioral health built to connect. This is Ascellus Behavioral Health.